Thanks, Vicki. Thank you so much.
Thank you. Okay, Mr. Chairman, next we have Ms. Sugai, Human Resources.
Good afternoon.
Good afternoon.
Good. Hey, Ms. Dow, how are you today?
Doing great.
Good to see you.
Thank you. Trying to follow the same format everyone else has, let's talk a little bit about what Human Resources does. We do process payroll and benefits for over 1,200 employees. We average paying between $900 and $1,000 per month. We serve as custodian of employee records. We oversee compliance to personnel policy, and we monitor adherence to legal guidelines. This is relative to employment like EEOC, Fair Labor Standards, ADA, FMLA, those types of things. And we're responsible for the recruitment and retention of our staff. Talking about recruiting and retention, that has its own set of tasks involved. We manage position control, resource applications, we manage applicant flow. We have a new hire orientation once a month. We do an annual review of salaries. We do that by surveys, both the public and private. Annual review of job descriptions. We facilitate an annual review of employee performance. We monitor the avoidable and unavoidable turnover. That's something that we share with you in the quarterly reports because we believe that's a scorecard for us. The lower the turnover, then that tells us we're doing some hiring practices that are correct. We're doing some things to retain our employees. And we also do a number of employee surveys. We do surveys to determine what our employees feel are our most important benefits. We do some surveys when someone leaves our employment because sometimes as they leave they will be a little more open about some of the concerns or some of the good things that have taken place. We also process payroll and benefits, and we do a lot of record keeping. Under benefits, we have our basic core benefits are our health insurance, life insurance, retirement, paid vacation, paid sick leave, the 401k with a match of up to 2%, and the Joe Terrell Productivity Program. Some of you newer on the board may not know what that is, but we have a program in place that if an employee has a good idea, either a way to save money or to perform a task better, they submit that through our Employee Activities Committee, and it's screened and then brought to whatever area it's applicable to. And then if it's accepted as a great idea, we'll monitor it for a year, and they can receive up to 10% up to $2,500 of whatever's saved. For example, if they bring an idea that saves us $5,000, then they can get 10% of that at the end of that. It costs us nothing because we pay the reward out of the savings. And if they bring an idea that's just a better way of serving our community, then we compensate them by maybe giving a day off with pay. And this has been an interesting tool. You get your best ideas from the people out there actually doing the job. Have a lot of optional benefits. I kind of went back and forth on whether I should put tuition reimbursement under optional or core benefits. It is a benefit that's offered to all employees. We've discovered that there is very little cost attached to that simply because the people who are using it are also people who tend to be in our succession plan, and we have planned for training for them anyway. But it is an opportunity for people. So this is just some of the optional benefits and benefits that, other than that, when employees pay for the dental, short-term disability, long-term care, deferred compensation, gym discounts, the volunteer program. The volunteer program may be new to some of you. If our employees volunteer out in the community as much as 1 hour a month for 12 months, they get an 8-hour day off with pay. We have a payroll deduction opportunity for paying your property taxes. That benefits everybody. Payroll deductions for charities such as United Way. Reduced cell phone plans, Vision Life, free checking, Sam's Club, credit union. Our staff, there's 4 of us, myself, Linda Tipton is our payroll benefit administrator, and I have an administrative assistant, Kim Wells, who works with our applicant flow and workers' comp, and Louise Adams, who works with payroll and benefits. We don't make you money, I'm sorry. We don't generate revenue. However, we do capture some savings through our self-insured workers' comp program, our self-insured health program, and managing turnover. Managing turnover is what I mentioned earlier about our surveys. We do some things to make sure that we're doing the best hire we can and also that we retain the quality. And our turnover has gone from, when I came here in 2003, we had about 24% turnover, and we're down to around 3% now. So this from 24 to 3 of the avoidable turnover. I do want to stress avoidable. When someone wants to retire, they retire. Workers' comp, this has been a biggie for us. We've been self-insured since 2005, and this has resulted in a savings of $2.1 million over the past 7.5 years. If you divide that by 7, I will tell you that more than covers the salary of my 4 staff members. So while we don't generate, we kind of cover our own debt. But the most important piece about this is that we've built a culture of safety in the county in which we do the best we can to provide a safe environment when our employees agree to work safely. Healthcare, yes, sir.
Could I ask you a little bit more on workman's comp?
Absolutely.
Do we not pay anything for workman's comp?
We have a reinsurance policy that runs us around $60,000 a year. Before we went self-insured, we were paying $660,000 a year for fees. So we've gone from paying $660,000 to we pay a reinsurer the 60-something thousand. Now, and then we pay the actual cost, and we pay a third-party administrator, Key Risk, $16,000 a year just to handle our claims.
Well, true, but if you're talking about the savings of the $600,000, I assume we pay some claims out on
Absolutely.
workman's comp. How much do we pay out on claims?
It varies from year to year because it depends on the accident. One of our worst years was around $400,000, which is $200,000 less than we were paying in premiums before. This year we're tracking really well. We're averaging less than $20,000 a month, so we're probably going to end out the year spending less than $200,000. That's
So
amazing.
you couldn't count the entire $600,000 as
Oh, no, sir.
Okay.
Now, the $2.1 million is not a number I came up with the year before last, just because sometimes when you think you're doing the right things, you need an objective person to come in and look at it. We hired someone from, as a matter of fact, a consultant from BB&T to come in and look at our process and say, okay, this is what you're doing versus what if we paid first dollar or had an insurance company that paid first dollar, and they came up with that figure.
Okay.
So that's how we came up with that. Our health insurance, this is something you don't hear a lot, but as we did our renewal last year coming in to the current fiscal year, for the first time we were projected to spend 6% less than the year before. Now, how often do you hear that in health care? However, our employees have worked really hard to make this happen. We have a wellness facilitators group. It's a representative from each department that meets and helps to put together some wellness initiatives. We do some things like we targeted obesity and smoking. I'm going to talk to you a little bit about that later on with some of our concerns regarding legislature. But we have put some programs in place for smoking cessation, and we've had 117 employees stop smoking under this program. We've started working on obesity this year, and we've had, I can't tell you how many pounds because nobody asked me to weigh anybody, thankfully. But we had, as they went for their annual physical, the doctor determined whether or not they were considered obese or not and recommended some type of weight management program. But I've had employees come by all excited saying, I've lost 17 pounds or I've lost 30 pounds, so we know it's been effective. The reason we targeted those two issues first is because our high risk and our higher claims for previous years had all either had as its cause or were exacerbated by obesity and smoking. So we knew that if we could help our employees make better lifestyle changes and choices to target those two issues, that it would reduce our expenditures. Another thing we did is we required an annual physical. So you might think, why would you tell someone you've got to go have a physical? And we've moved it now to every 2 years. Why would you tell someone you have a physical that involves an expense? Well, it does. But we've seen a trend then when we had someone form a relationship with a private care provider, then the expense of going to the emergency room, which was running us at least $1,200 on average, at least, if we had a private provider for that employee, they were coming near getting those issues addressed before they became emergencies. And so the expense was greater, much less. So that's been a tremendous savings, routing people to lesser expensive areas like immediate care, medics, those kinds of places that the expense is a lot less than the emergency room. The emergency room is there for critical issues, but it's helped control the cost in that. We partnered with health educators in the health department. We give free flu shots and pneumonia shots for employees. We have an annual health fair. We sponsor a lot of things like having seminars where we talk about diabetes, heart disease, and those kinds of things. We have organized walks. We have Weight Watchers at work, Zumba dancing. We have smoking cessation classes, gym discounts, Blue Points participation, which is participation in our Blue Cross Blue Shield program. We have bowling teams, a softball team, and we provide 5 free visits with a nutritionist, which has been very beneficial. We're not mandated as a department, but we do manage processes that are mandated, like our EEO tracking with our applicant logs, adherence to Fair Labor Standards, EEO reporting, FMLA compliance, ADA compliance, those kinds of things. The effect of state and federal changes. House Bill 4, Unemployment Insurance Fund Solvency and Program Changes. Although we're self-funded, under the new bill, we're going to be required to contribute to a reserve fund. And you guys are nodding.
How much is that?
At a
What
minimum of
percentage?
1% of taxable payroll, so we're talking almost $400,000 a year. Not a year, that we have to put in a reserve fund.
Put in
and
a
as we
reserve
use
this
it.
year.
It's starting this year, 1%.
Yes, sir.
1%.
And what irritates me about that, the actual payout for unemployment last year for the county was $32,000.
Doesn't make sense.
It doesn't make sense to me, and it's very irritating.
Are they gonna leave it at 1%, or is it gonna leave like an experience rate where
It's
it
gonna-
can rise?
It's going to be an experience rating. The reason we believe we'll start it at a minimum of 1% is because we don't have the same type as self-funded. Our
Yeah.
experience rating is not exactly calculated the same. So we know it's going to be 1%. So that kind of hurts. That's money that they're going to take and put in a fund that we don't have control, we don't have the benefit of interest or anything.
Well, we don't keep it in our fund. You have to send it off.
Yes.
Is that state? Yeah,
Yes.
state.
Yes, sir.
State of North Carolina?
Yes, sir.
Have you discussed that with our legislators in
Yes.
regards to
Yes, sir.
exempting
Absolutely.
counties?
Association is really working on this. This is one of those because it is a killer. I think the 400,000, and Pam, Sue and I, we've talked about it, it could very well be $500,000. That's a penny on our tax rate this year. That's a
Well,
lot of money.
And that may be something we need to do, and that is set up a meeting between the commissioners and our legislative leaders and our
We'll talk to the
representatives.
association on where they are, but I know on some of the conference calls and discussion, I know the chairman with Rebecca and David have heard, they're really, championing this thought, but this is a killer for cities and counties.
What happened, we got so deep in debt, in
Yes.
recession, and the UI fund is just billions of dollars in debt. We're borrowing
Yes.
money hand over fist from the federal government, which you gotta pay back.
This is going to
That's
help
the
shore,
intent.
they're using us to help shore up that account.
That's,
But yet, we've paid our bill all
And the
along.
irritant, Mr. Pate, you're exactly right.
yeah.
We keep ours around $30,000 a year, and yet we're going to be expected to put $400,000 in the reserve fund. There's just something grossly unfair about that. So whatever you guys, whatever influence you have that can help with that, that would be awesome.
So when you put the 400,000, if it comes up to $500,000 in a reserve fund, then is it there for someone else, or is it there for us? If we're at a history of 30 to 40,000, I mean, what would they expect us to get to 400,000?
Well,
Are they giving it to someone else?
as we pay claims, it comes out of that, and then we have to put it back in the fund to keep it at 1%. And I don't know the mathematical reasoning, but I'm assuming they're going to be making some interest on that somewhere,
Sure.
that
The
they
answer to
get
your
to
question,
keep.
Mr. King, yes.
So that would be supporting
Go
someone
somewhere.
else.
They have access. Yes.
Okay.
I knew that wouldn't make you smile. The next piece that could have budget impact in the next year, but it has not been voted on or finalized, the Healthy Families and Workplace Paid Sick Leave Days requires 1 hour paid leave per 30 hours worked. Now, for our full-time employees, they accumulate 8 hours a month sick leave, so we're fine there. We have employees that we consider, we call them permanent part-time, and they average 30 hours a week. They get prorated benefits, they're fine. But the bill does not clearly spell out, okay, where are those other 30 hours? If we have other part-timers that may not work any this month, and next month they may work 174 hours. So you see an administrative nightmare there of calculating 1 hour per 30 hours work. And also, you got to fund it, because if they're out sick, then we're having to pay them. So that one has not been passed yet, but it is a concern to us. The next, yes, sir?
Is this a federal regulation?
State.
State.
House Bill 4.
So the second one is a state.
Yes, sir.
Okay.
And then just to add to my happy news, local government, as you know, some of the rules that apply to private industry do not apply to local government. And under the HIPAA changes, under health initiatives, I mentioned to you earlier that we were requiring physicals and that we were targeting obesity and smoking. Well, in the local government arena, your personal being is your private personal area. Just like I can't just randomly drug test everybody, I can only drug test under very specific circumstances in local government. I'll tell you, that was a real cultural breaker for me coming from private industry before. In that same essence, we can no longer, starting with 2014, we can no longer require a physical. We also can present wellness programs, and we can have some type of penalty if you don't participate in wellness initiatives, but you can't base it on outcomes. So we can't use smoking and obesity anymore. We can do smoking cessation classes. We can say, okay, you have to have 3 wellness points to stay on the insurance, or if you don't, you're going to be moved to our less rich plan or something like that. But it can't be based on outcomes, because that is considered an invasion of their personal being. And so that's upsetting to me. Mr. Parker knows it is, because he got the ruling from School of Government, and I even questioned it again, because I needed him to tell it to me again. But
Was that a federal or a state?
that's state, isn't it?
State.
State's killing me right now.
I'm telling you, we need to talk to our legislators.
HIPAA is federal,
Yeah.
but the smoking cessation, that
It's state.
North Carolina has a statute. I will tell you, I was not aware of it until February of this year, that says you cannot do anything that prevents somebody in North Carolina.
But I'm not understanding, is that a federal requirement regarding the prohibiting you from asking for a physical?
That's
That's
state,
state of North Carolina.
right?
That's state too?
Because I went to the
State
School of Government.
based on HIPAA.
Based on that HIPAA, the School of Government interpreted that to mean that we can't ask for anything that might in any way violate their right to their own being. And if I require them to have a physical, then I'm telling them,
Oh, well, now we're getting a little different here now, because you're talking about an interpretation by someone.
But now the state has interpreted it that way.
that's their
And
interpretation.
now mandating it in this direction. Other states are not.
Well, I just recently ran across something similar to this, where an individual in state and human services interpreted that the county health department could not charge a copay. That was one person made an interpretation. Well, all of a sudden, that interpretation is not valid, and so they're rethinking that now. So my question is this a law, a regulation, or an interpretation by someone?
I-
With respect to the smoking is a North Carolina statute.
Statute,
It's
okay.
law.
In regards to getting a physical, is an interpretation by someone at the School of Government. Is that correct?
Yes, but I would tell you that I would not be the one, I would not recommend that Wayne County challenge it. Would you agree?
We can certainly ask.
You can ask a
certainly
question and
ask.
ask for another interpretation. By when I say challenge, I don't mean question, why would you do this? But I'm saying, would we want to just go ahead and continue with our program, even though we've been given this document that interprets it, and fly in the face
No,
of...
we need another interpreter.
Exactly. That was my point when I said challenge. I don't mind
Okay.
challenging things,
Yeah.
but I think we do it selectively.
Implement it without having a change in
Absolutely,
it. I understand
absolutely,
what you're saying.
absolutely.
Okay, I'm sorry.
That's fine. Any other questions on that? Okay, trends, online training. I think Mr. Cross mentioned to you guys the cost of if employees are shut down for an hour. Well, I've for years said, every time we have an hour training anywhere, it costs us $7,000 for the number of people that show up by the time they leave their work area and go to the training site. We present the training, and they go back. So we're working now, and we're actually testing it out in the safety arena, doing our mandated training online so that employees can do it at their desk, and we save at least that travel time back and forth. And we also have an issue with having enough meeting rooms large enough to accommodate that. So online training is something we're looking at. Discount benefits managed via the intranet. We're trying to look for added value, added benefits that cost us nothing. And this is a trend. There is a company that we're working with called Perks, and they've already started visiting some of our Wayne County businesses because that's what we want to promote. Our Chili's, our Sam's Club, different places like that, and generate the agreement that if they bring to them the advertising potential of 1,200 employees and their families, they will give a discount, and it's a downloadable discount card that the employees can go down and download and use it at these particular retailers. So we think that's a win-win for the employees, and it's also helping to build the economy in the county. Virtual offices, that's a trend, and we really need to think about that. You guys have visited the buildings, you know what some of them are dealing with, and so we probably should talk about virtual offices. HR's impact on the community. We facilitate our community partnerships with our charitable issues like Cures for Colors, United Way, our volunteer program, contributions to food banks, support of the soup kitchen, Adopt a Family. For Christmas, we also have 2 blood drives a year. We participate with the school system and the Air Force Base in job fairs. We go out and visit the schools and present, help them work with how do you go for a job interview, that sort of thing. And we participate in the annual job shadowing program. Some of our goals, we already have a succession plan in place. We are going to have to focus more on that because within the next 5 years, 8% of our key talent is going to retire. And so we've got to come up with technology and training that will make sure that we have a seamless transition. When I say key talent, I'm not just talking about department heads. We have people with very unique skills. Some are very unique for county government. So we need to know that we've got somebody in the shadows to step up. And if it's not somebody internally, then we need to know where those folks are externally so we can recruit them.
Ms. Guy,
Yes, sir.
I really appreciate you bringing that up. All 7 of us were elected at the same time. We've got 4 years to sit here, all 7 of us. And and you said within the next 5 years,
Yes,
that's
sir.
on our watch.
Absolutely.
And this is just something that is just all of a sudden just jumped out at me and said, wow, I'm glad I heard that right now.
Absolutely.
Thank
We
you.
have 3 of our department heads now that came through our succession plan, and it's been a wonderful transition. We just got to do more of it.
Thank you for,
Thank you. We need to seek more creative use of bricks and mortar as it relates to offices. We're already doing some of scanning of files, and we need to look at who really needs an office, or who can work from their car, or who can work from their home, so that we make best use of the space that we have. So what questions do you have?
Commissioners?
Nobody has a question?
Well,
Unbelievable.
I saw some figures the other day, and it's maybe workers' comp and its claims, and it was a couple of $2 or $3 million, and is that, is that, sir?
No.
Was that, we're self-insured,
Yes, sir.
and when workers' comp claims come to us and we have to pay those out,
Yes, sir.
then we're responsible, I guess, to pay those out. And at the end of the year, we see what we've paid out. And those figures are,
I actually...
are they extremely high, or are they low?
Very conservative, very conservative. We paid $5,000 last month in workers' comp. $4,000 of it was one employee that had surgery. That gentleman is phenomenal for
So
1,200 employees.
I was not right when I said million.
I'm not sure where you saw that, but
I
we
think that
don't...
was in the health insurance.
Health insurance, yes, sir.
Oh, okay.
Health insurance is over $5 million a year.
Yes.
It just is.
Okay.
Almost
okay.
$6
Thank you
million.
for clearing me up on that.
Yes, sir.
So many numbers in my head, so I'm trying, okay, it's not workers' comp.
No, sir,
It's
that's health insurance, and
health
it is
insurance.
significant.
We're self-insured.
We
so
are
health
self-insured
insurance.
there also.
So we average about 5 million.
Yes.
Okay.
And we keep a balance now. We're above 1.5 million because our goal is to keep it at 1 to 1.5 million, and we're between 1.5 and 1.8 to keep that. Plus, you're flushing out that that 5 million all the time, but to keep that balance there, and we had to build that up, and we have, and we've maintained it for several years. So.
And we went in that in '05, correctly?
Oh, it's been true
did
for
we do
many
it?
more years than that.
Yeah.
What happened in '05 is before we had another level of expense that was simply handling our claims. They were turning the claims into Blue Cross. We pulled that into my office, and someone in my office, as claims go in, they go straight to Blue Cross Blue Shield now, and we can manage it by web-based. If there's changes, address changes, adds, deletes, we do that all web-based, and we're not paying another level of administration, so we have a very low administration cost. As a matter of fact, the year that we had someone come in and look at workers' comp, we had them look at our Blue Cross Blue Shield, and he couldn't even get anyone else to make a quote. They said, there's nothing
They
to
couldn't
your
touch
file.
it.
So how does this Human Services tie in to our health care plan when we look at the total health of Wayne County with our summit coming up, or our health?
That's a good, I see where you're going, that's a good point, and I think
'Cause
one
if
of the
we-
things that I've talked to Mr. Paul about at the hospital, Sue, a number of us have talked about this, and Joanna and Mike, for industry and the possibilities of, and this is a little scary to some, but community health organizations where you develop pools, where you direct, like we do with our EMS, all of our folks, if we can, Borden, to the hospital. Can we have a insurance pool of industry, of cities and county, whatever, where you direct them to the hospital, to doctors, and you create your own network? It works
Yeah, Mike,
all around the world.
And my thought was with that, is the claims that we're paying as our percentage of elderlies from 28 to about 32% over 50 in Wayne County. And then if we're looking at an older part of our employees getting to the age, baby boomers. So if we're getting up to that part where we're paying over 5 million, 6 million, 7 million within the next 5 years, is it possible? And if it is, then how do we reduce that? Because of the health care change that is
Yes.
happening in America. So it comes down to the county. How are we going to?
You know, and I think it's a good point, and I think it's probably we need to integrate that in that thinking, so I'll pass that on to Mr. Madden at the Health Department. But I think we also, with the industries, with the cities, I think there's some opportunity, but it takes all those partners that we've talked about, those stakeholders, it would take all of us.
Yes.
It would take all of us. But I mean, I think it's definitely something we need to look at, because we do have, now for us, we have some older population within our workforce, but we've got that lower number, and they're not using the health benefits as much. But if they stay, they will. And how do we deal with that?
Yeah, we look out 5 years,
You
10
know,
years.
how do we get them at Wayne Memorial versus, sorry, Wake, Wake, how do we keep them here? And, you know, because, and incentivize to do that. Well, would they give us a discount? Would they give us a, you know, and Bill, Paul, and I have talked about that. I mean, I think it's something we need to have that conversation.
Okay.
So I think you're right. You're
Thanks,
right.
I'm sorry. Okay.
No, that's fine, that's perfect. Any other questions?
Well,
Yes.
one question I had, and that is on your second slide here, you said there were 1,200 employees.
Yes, sir.
I thought we were around 800.
No, sir, 1,200. We pay between 900 and 1,000. We have 3 different categories. We have our full-time employees around 700. We have our regular part-time. Those vary as far as their scheduling on when they work. Then we have, I call them roster people. In our EMS department, solid waste, we have situations where if someone's out, we physically need someone else we can pull in, but we don't really need to keep them on the payroll as far as paying them all along. We pay them only when they come in to fill it in for someone. So we average paying between 900 and 1,000 every
But you've
month.
got about
But we've got
1,200
1,200,
regulars.
including all of the
Rosters and
Well,
everything.
okay,
Yes.
all right, that's fine. And we'll go into some more extensive discussions on the health insurance and self-insurance and all that during budget time.
Yes.
Okay.
And we'll have all the data for
Yeah.
everything.
Okay.
Thank you, Mr. Daugherty.
Any other questions?
Thank you, Ms. Guy.
Thank you for your time.
Thank you.
Is that the last one back there?